Hello, my name is Marianne Bohr from HIMSS, and welcome to today's webinar. Thank you for taking time to be here today. We have an exciting program for you, but before we get started, I want to highlight a few things so that you'll know how to participate in today's event. At the bottom of your screen are multiple application engagement tools you can use. All of these engagement tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you need technical support during today's event, click the question mark icon in the navigation menu at the bottom of your screen, where you'll find answers to frequently asked questions. Or you can type your question in the Q&A widget to the right of the media player. You can use that same box to submit questions for our speakers at any time. If we don't get to your question today, we'll follow up with you offline. Engage with today's content and let us know how you're feeling with the emoji reactions. If you miss anything, don't worry. You'll receive an email within 24 hours with a link to the on-demand recording when it becomes available. So now, let's get started with today's program. Scaling CC&C adoption, nurse leaders discuss ineffective nurse call, alert and alarm management, and patient transfer use cases, sponsored by Mobile Heartbeat. This program will focus on clinical communication and adoption strategies. Proposed themes include operational and clinical perspectives, adoption journeys, and use cases such as nurse call systems, alert management, and integrating AI into clinical workflows. Our speakers today are Dr. Annabaker Garber, Chief Clinical Officer at Mobile Heartbeat, and Dr. Kathleen McGrow, Global Chief Nursing Innovation Officer at Microsoft. And our moderator is Kelly Elliott, Director of Marketing at Mobile Heartbeat.
Welcome. Hello, everyone. My name is Kelly, and I'm the Director of Marketing at Mobile Heartbeat, and I will be guiding us through today's discussion. Let's meet the panelists. Our first speaker is Dr. Annabaker Garber, who is an experienced health technology innovator and business leader with extensive experience in clinical informatics and nursing leadership. From 2016 to 2022, Dr. Garber served as the Chief Nursing Informatics Officer at HCA Healthcare, where she spearheaded several clinical initiatives, including an enterprise-wide implementation of Mobile Heartbeat's clinical communication and collaboration platform, and various other applications such as telemetry, care team assignment, and patient rounding app named Orbit. Her strategic approach to technology integration led to the development of an app for capturing patient wound images and other innovative solutions that significantly improved clinical process and patient care. Dr. Garber possesses in-depth experience in various facets of electronic health record implementation, including education, training, support, adoption, and optimization. Her academic credentials are equally impressive, with a master's degree in nursing, specializing in psychosocial nursing, and a PhD in physiological psychology. Dr. Kathleen McGrow is the Global Chief Nursing Innovation Officer at Microsoft. She advises on digital transformation challenges, including workforce crisis, consumer and patient engagement, and cognitive computing for a learning health system. Dr. McGrow holds a Doctor of Nursing Practice degree from the University of Maryland, Baltimore, with a background in trauma, critical care, and IT. Her work includes publications on AI in healthcare, such as foundation models, generative AI, and large language models, essentials for nursing, and implications of artificial intelligence for nurse managers. She co-chairs the HIMSS Nursing Innovation Advisory Committee and is an adjunct clinical instructor at the University of Alabama at Birmingham School of Nursing. Welcome. As we get started, let's define the problem. Annabaker and Kathleen, as we set the stage, what would you identify as the biggest challenges nurses face when it comes to the toolbelt of technologies and how they are being adopted and or lack thereof? Annabaker, let's start with you.
Well, I think the first problem is that nurses have a tool belt at all, right? And so in my previous organization, we counted up the number of computer-based or other technologies that nurses had to interact with, and it numbered over 30. So the nurses are always switching between one thing and another and trying to remember how this one works versus how that one works. And so it's really hard to have an integrated kind of workflow or a uninterrupted thought process when you have to switch between 30 things in the course of your work.
I totally agree, Annabaker. And I think just to call it out, you didn't say it explicitly, but there's this huge amount of cognitive burden that occurs with that when you have all of these, different devices. I agree with you. We used to call it the utility belt, right? Multiple devices, et cetera. But it causes a tremendous amount of cognitive overload And it really, it kind of introduces this thought that it's okay to interrupt the nursing workflow regardless of what they're doing. So I think that it's a huge problem. And part of it is that nurses are fantastic multitaskers and they want to get the work done that they need to get done. So they try to leverage everything that they have at their fingertips to be able to do effective patient care. But we need to help them be a little bit more streamlined and a little bit more thoughtful in how they do that.
And I think communication approaches within a hospital are particularly guilty of this. So, you've got one set of doctors who only want to be paged. You've got another set of doctors that you can text them on their personal phone. You've got another set of doctors who don't want to be contacted at all. You've got the EMR that lets you do one kind of communication. You've got a phone that lets you do another kind of communication, and it's very fragmented. So you're making a difficult problem already worse by fragmenting your approach to communication. There can only be one medication dispensing machine, but you don't need to have 15 different ways of communicating. Really consolidating that makes a huge difference in the nurse's cognitive burden.
Yeah, and I'll just add, I know the Joint Commission says that between 70 to 80% of sentinel events really occur from either miss or a lack of communication. So I think that while we think we're doing an effective job in communicating, that's not always the case because it is so fragmented, to your point, Annabaker.
So I think there's a real opportunity to elevate the importance of that communication and streamlining it, making it predictable, and providing communication that allows an organization or a nurse to match the kind of communication they need to the situation at hand. I think that's another piece that often gets overlooked. So I think there's some really elegant solutions to that, and it's important to understand the opportunity cost that happens by spending so much time trying to communicate and the safety implications of having fragmented communication and the cognitive burden, death by 1,000 paper cuts that happens when you make it really hard to find somebody.
Yeah, I agree, Annabaker. I think, we should clarify the 3 C's on the title are really around communication, collaboration, and care coordination. That's kind of how I think of it, those 3 C's, because they're all excessively important. And they all go to what you're saying as far as having to be decreasing the friction, the fragmentation, and kind of streamlining that as far as workflows go.
That's excellent. Now, as we think about the adoption journey, it's, Annabaker, you've often noted that it's important to start from the ground up with the least operationally complex workflows like nurse call integration before progressing to more complex workflows like patient transfers. Annabaker and Kathleen, can you walk us through a few of the use cases from the least to the most complex and how, if done effectively, they can benefit the care team and ultimately patient care delivery?
So before we get to nurse call, let me just say that, one of the most beneficial things you can do is make it easy to find somebody in a fully functional and flexible directory. So having a telephone book-like directory works if you know the name of the person that you're looking for and you know how they're listed. So, if Kathleen is listed as Kathy or as Kate, you're going to have a hard time finding her if you don't know that. Secondly, Kathleen might have a role on a unit. She might be assigned to a patient, and she might have a role that she's adopting for the day. So she might be a charge nurse that also is carrying a patient load and is assigned to certain patients. So if I'm just looking for the charge nurse on that unit and I don't know that Kathleen's assigned to that, I still want to be able to find her. And if I am a physician or a respiratory therapist or a PT and I want to know who the nurse is that's taking care of the patient for today, I want to be able to find a list of those folks as well. So the first things first, you got to be able to find the person that you want to talk to. And I don't want to have to remember the super secret phone number that the house supervisor carries. And I don't want to remember the super secret number of pharmacy. I don't want to have to remember all those numbers. I just want to be able to find the person. So a very flexible directory creates the platform by which it's easy to find the other people that you want to coordinate care with, and to be able to communicate to somebody directly. The second thing is that you want to be able to use your communication system to be the conduit or the last mile through which clinicians get timely information about the patient. So the nurse call is the most straightforward of the integrations. Right now, many organizations have a very inefficient way of answering the nurse call. It may go to the unit desk and hope that somebody is there, and somebody answers that call at the desk and then has to turn around and find either the nurse or the tech to go see the patient. Much more efficient to send the alert directly to the patient, and you get extra credit if you can then talk to the patient through the phone that alert showed up on. So it's one thing to get the alert. If the nurse still has to walk into the room to find out what the problem is, it's still not very efficient. More so than going to the desk, but less so than when the nurse can see the alert and talk to the patient directly in that moment. Hey, Kathleen, what can I do for you? Oh, is it time for my pain pill yet? Here, let me check. Oh yeah, it is. I'll go to the med room and I'll be in your room in just a few minutes. So in that integrated interaction, I've talked to the patient. I found out what the problem is. I took the action without having to pause to find the right person, go into the room, find out what the problem was, then go take the action, then go back and see the patient. Thoughts, Kathleen?
Yeah, I think a couple things that it's kind of seamless within the workflow. And the way even you described it, it's kind of like the role-based access controls, right? Annabaker, like if I'm the charge nurse, I can be identified as the charge nurse, which I think is how most organizations set up their directories, right? I come in, I'm charge nurse in my unit, the trauma resuscitation unit, and then I, hand off charge on the next shift to the next person. So you don't really need to know that I'm actually the charge nurse. You just need to know I need the charge nurse. I think the other thing is that when we're looking at, how it seamlessly fits into the workflow, that we actually, it's easy to find and communicate with the other users. It's how you're used to operating your own devices, right? So that kind of makes it, frictionless because it's a workflow that you're used to doing, and it's a form factor that organizations, their users are used to using. So I think that is really important. I also think that you have a variety of formats for messaging that are able to be utilized across the platform. So you have the ability to call, you mentioned call, and then you also have the ability to text, and we could also do group text, et cetera. So I think it's things that the end users are used to seeing in their everyday life today. So it's not something that's out of the usual. So for them to adopt it, I think it's pretty straightforward. Although I will say, as you mentioned, Annabaker, you have to kind of start with the lower hanging fruit use cases, then you kind of move to the more complex. I know we're going to get to that at some point.
Yep. So thanks for bringing up the point about the forms of communication. Texting is really powerful, and we've all adopted it in our daily life. And we've all had the experience when the text string gets too long, you start to lose information. It's really quick, but it's also not very dense informationally. So if you really need to understand the emotional nuance, or you need to convey a lot of detail, text messaging is actually not very effective. But if all that you have that's easy to get to is texting, then it gets way overused. And so organizations might think that they're doing a great job of adopting text because they're sending 1 million a month. But I would argue that often it's being used inappropriately, and it's not actually being effective after a certain point. So next is the phone call. Phone call is really valuable for conveying a dense amount of information in a short period of time, but it seems to be more interruptive, and it's a little harder to ignore the phone ringing than it is to hear the ding of the text go off. So you don't want to call all the time either. If all you have is a voice-activated device or phone calling, that's particularly interruptive And if you have a voice activated device, everybody can hear your conversation. And it's, it's a lot of steps to go through just to confirm something quickly. Hey, are you on your way? Yep, there in 5 minutes. You don't want to make a phone call for something like that. So being able to match the level of communication and the density to the situation at hand is really important for both efficiency and satisfaction. Group texts, patient channels, alerts, broadcasts, or other kinds of communication that round out the suite of communication and can be matched to the situation. So an alert conveys the a change in the patient's condition that requires an action on the receiver's part, and a broadcast message is a one-to-many event. So if I'm the nurse leader I'm the administrator on call, and I can send out a broadcast message to the entire hospital saying, welcome to our friends from the State Department of Health today, right? It's a surprise inspection. Or something as simple as cake in the break room, or our staff meeting is starting in 10 minutes, those kinds of things. So having that flexibility creates the opportunity to have all kinds of improved efficiencies in all kinds of workflows. And that's where the value of the investment in a CC&C platform shines out, is bringing improved efficiency and value in lots of places. So anything else you want to say about nurse call or types of communication, Kathleen?
No, I think that's great. I think you covered it. I think you actually moved us already into the device alert notifications, Annabaker. So that was kind of a good segue into this segment. And this is really the delivery of those actionable alerts to, I think, the right person at the right time, which I think you mentioned a little bit, if you want to kind of expand upon that, and then I can add perhaps.
All right. So, alerts are life-saving, have the potential to be life-saving, right? If I'm a nurse and I get an alert that is a life-threatening arrhythmia, and somebody else has called the code from the central monitoring unit, then it's an all hands on deck, very fast response to the problem. However, if we as an organization choose to send alerts that are not actionable, and don't require the immediate response, then the clinicians who receive those alerts fall quickly into alert fatigue. And so there's a real balance here, right? So, one really highly valuable use of alerts is to take an alarm that is, of a physiological monitor that, is triggered because the patient has exceeded a threshold or demonstrates a state that requires intervention. Turn that into an alert, which shows up on the nurse's phone and says, patient so-and-so in room such and such is experiencing high heart rate. Then the nurse can immediately go into the patient's room and take a look at what's going on and figure out whether they need a medication or a cardiology consult, or figure out what the next action to do is. But if we choose to alert on send that alert with too much sensitivity, so the patient's baseline heart rate hovers around the threshold, and every time they cross it, it sends an alert, that's alert fatigue, and it has no value. It's annoying. And so we've really got to put in processes in place to manage the excessive burden of various kinds of alerts, to make sure that when an alert comes through, the nurse really knows that there's something to do about it. And when alerting becomes the solution to all of your problems, now we've really got an alert fatigue problem. So bed exit alarms is a really good example of that. In my previous organization, the nursing leadership felt strongly that somebody about to fall was an all hands on deck event and everybody should get the alert. But what we found out pretty quickly was that if everybody gets the alert, nobody thinks they're responsible. And then the patient's actually at more risk. So having a targeted workflow understanding what the time between escalations is, knowing what your responsibility is when that alert comes through, all go toward making an alert much more effective.
Yeah, and I think that is one of the benefits, one of the values, right, for mobile heartbeat is you have that ability to customize, and you can be flexible with that when you're setting up the alerts and the alarms, so that you kind of try to at least minimize the potential effect of alert fatigue, which I agree is, very prevalent throughout organizations. And if you think everyone is answering, then no one answers. So I've actually seen that happen in my practice myself. So I think having that ability to be able to customize and utilize the flexibility of the platform, I think is really essential to try to help avoid that. I also think that these are the types of learnings that organizations have as they move forward with implementation, so they can kind of make those changes as they go incrementally, right? Sometimes you don't necessarily know potentially what the parameters may be, and you may have to relook at them and reevaluate them, if I'm not mistaken.
Yeah, it's a process improvement. It's a continuous process improvement. You don't just put it in and then let it go. Yeah, you really have to realize that when you do the implementation, you're on the hook for ongoing optimization. It's just going to become part of the work that the hospital needs to do. The other I think less efficient approach that organizations often take is that they've got a clinician at a distance, somebody watching patients who are falling, or a central monitor tech, or even a virtual nurse, and they're calling the nurse at the bedside, which means the nurse's phone is ringing. So the phone ringing sounds no different if it's an immediate event that needs action, from a doctor trying to get a hold of her, from the family trying to get a hold of her, from somebody, right? And so it all sounds the same. And so she's got no ability to discriminate and figure out which ones she can put off till a little later and which ones she needs to respond to now. So creating alerts that have tones that match categories of events helps. So when she hears that tone, oh, that's a critical event, I'm looking at that alert right now. Oh, that's an event that I can wait a minute to look at. And so, and when my phone rings, now I know it's actually somebody I want to talk to. So you separate out the use of a phone call as an alert, and you customize the alerts so that it's easy to understand what's actually happening without having to look at it or getting overwhelmed and just ignoring everything.
Yeah, that's really fantastic that you have the ability to discriminate who that tone or what that sound is, especially if you need to kind of have be a higher awareness of specific tones, because we're all kind of trained now to listen for certain things from our phone, whether it's a text or whether it's a phone call or an alarm, et cetera. So it's great to know that the nurses have that capability, so they can really hone in on their practice and really understand when they actually need to potentially. We have a very interruptive workflow, right? Nursing is a constantly interruptive workflow. And there's times where you're up to your elbows, your gloves are on, and you don't have the opportunity to just jump on your phone, but people might think that, you have to answer immediately. So it's good to know that based on what you hear, you need to know that you need to potentially break and wash your hands and then answer that call. So I love that, Annabaker. I think that's fantastic.
Great. So once you get people used to interacting with the CC&C app, and they feel good about using it, you can start to build it into more complicated workflows, right? So like any other skill, you want to start out simple, and then you want to build on your successes. And so if you think about something that's as complicated as a patient transfer, there's lots of moving parts. There's the decision whether or not the patient's appropriate for admission, whether or not that there's a bed on the appropriate unit that's ready to accept the patient, making sure that the admission orders get put on the chart in a timely fashion. getting the patient up to that transfer bed, and then making sure that any care that needs to be done immediately upon getting in that bed, like putting a telemetry box on, has all been coordinated. And so if all of the players involved in that process are used to using the CC&C app in order to expedite the communication around that, then things go much more quickly. If I have to look in the EMR to know the bed availability, and I have to go find a transporter using another app, and I've got to call the teletech to get a box sent down, now we're experiencing that a cognitive burden that we talked about early on. So there's really two important components to being able to put it to use CC&C effectively in a complicated workflow. One is that you have to have widespread adoption among the people who are involved in that workflow. And the second is that you have to look at the processes. You have to do sort of a lean Six Sigma kind of process improvement approach, and look at all the places where communication is something that connects the first step to the second step or the next step. And ask yourself, what's the most efficient form of communication to connect those steps? And what's my fallback position or secondary approach if that first one doesn't work? So I'll give you an example. When we first put our system together for bed management, the bed manager inside the hospital went from having a set of serial communications, which was the phone call, first phone call, hang up, second phone call, hang up, third phone call, hang up. And she could only do things in a serial fashion. When she also added texting, she could then be running a couple of conversations at once and reserving the phone call for the more complicated discussion. And when she had broadcast messaging, she could also send a broadcast out asking for information from a bunch of units, or asking a unit about availability for nursing, or we could build that in as well. And so so you've really got to do a couple things. Again, everybody's got to be able to look for it, and the workflow has to be examined to figure out what kind of communication is most efficient at what stage.
Yeah, I agree. It's really important that you have to take into consideration that workflow, Annabaker. And I think, when you look at like your current state, what do you want your future state to be when you have the ability to implement a solution like mobile heartbeat? The other thing is that the offerings around integration with electronic health record, I think, really offer the opportunity. Patient transfer is mentioned on this slide, and it's a great opportunity because the solution can be very patient-centric. So there's actually a context of the patient within mobile heartbeat that when the nurse is calling or even texting to say, can you take this patient so I can call you to give a report, et cetera, that you can actually pull that into the workflow and you have the context of that patient. So I think being patient-centric is really important there, and helps to expedite the movement of those patients. And we know that's a huge constraint on organizations where they have patients that they don't have that ability to improve that throughput. So I think the throughput would really be key here, as far as improving it based on this ability to implement the solution.
Yeah, yes, I have had that experience. And, patient transfer happens all over the place. So not only from ED to the floor, but also through the OR out to post-op, and then out to the floor is another area where a CC&C platform can be really helpful. So being able to text the anesthesiologist, your room is ready, or text the surgeon, the patient's on the table, or coordinate from post-op up to the unit. And organizations can be open-minded about changing their handoff policy and the way that the report is given. And sometimes the CC&C can play a role in calling or sending information through it as part of the handoff process. So it really gives you a lot of flexibility. And again, it speeds up the time it takes to go from one stage to the next.
Yeah, I agree. I think that is one of the key, in my mind, the key drivers for really quality patient care is getting them to the unit where they need to be, right? We don't want anyone, in the OR longer than they need to be, in the recovery room, et cetera, in the ED. It's really important to ensure the patients are in their appropriate unit. And it's for both, right? It's for the patient for the patient themselves, for their quality care, as well as for the staff, because really for them, it's important for them to kind of streamline that workflow process.
Stepping back a minute to talk about the cognitive burden of nurses being disrupted. One of the things that Kelly did was she looked at the customer base that Mobile Heartbeat has. And, the average hospital is sending 62,500 nurse calls a day, right? So divided up amount the nurses, that's a lot of interaction with the patient, right? And if the nurse is spending 4 minutes trying to respond to each one of those, then that's a lot of wasted time. We've seen customers bring that down from a 4-minute event to a 31-minute event, or I'm sorry, a 31-second event. And so now we've saved 3.5 minutes per call over over 60,000. That's real time. We also know that, if you've got on average, if you've got somewhere between 160 admits a day, that's a lot of throughput process that needs to be done efficiently. And when there's wasted time or confusion or lack of coordination, it really slows everybody down, right? We also know that we've got a lot of burden with high visits in the emergency department, and often patients who have been admitted but are still residing in the ED for some reason. So increasing that throughput as much as 15% can unload the ED from the patients in the hallway, can speed up the rate of admission, and can help to decrease the number of interruptions and missed opportunities that are going on in the hospital. So when you think about how a hospital works, it's really a lot of micro processes. It's the nurse taking care of the patient, handing out meds. It's the nurse doing the ADLs and so forth. It's the physicians talking to the case managers. It's transporters moving patients back and forth between radiology and the unit. It's patients coming from the OR back into the bed. It's respiratory therapy, round and around. It's hospital rounding by nurse leaders. There's all kinds of processes that are going on. Many of them interact. And so if you can make improvements in these micro workflows, you can make your transporters more responsive. You can get the lab tech to the patient for a stat lab faster. You can answer the nurse call faster. You can make it easier for the physician to find the nurse taking care of the patient so that he can check to see whether his orders need to be changed or not. All those things add up to a lot of time tied up in communication. And when you can improve each of those a little bit, you increase the overall efficiency of the hospital a lot, and you free the clinicians up to be able to spend more time actually interacting with the patient. And you often have a less frustrated patient because you're being able to provide services in a more timely fashion. So if you think about the micro processes where your communication is less than stellar and you bring attention to those things, it's going to have a cumulative effect for the way the rest of the hospital operates.
Yeah, we know throughput is a huge pain point and it's an issue across organizations. So this is a really great opportunity in order for us to be able to make those improvements, Annabaker. And I love how you've described the micro improvement to the macro improvement, and that is an ongoing process.
And I think, it begins also to create kind of a halo effect. The nurses know that they're going to be able to find the doctor. They know they're going to be able to find the transporter. They know they're going to be able to get notified about something in a timely fashion. And it just, it creates a sense of trust. And it also unifies your culture because now we know what to expect about how to communicate, what kinds of communications we're going to get about what kinds of processes, and everybody's on the same page. And that in turn creates a sense of sort of unity and cohesion in addition. So how do we achieve this, Kathleen?
This is it's a great challenge, Annabaker. Obviously, I'll go ahead and let you start, and then I'm going to add a little bit on about where I think we need to work on things.
So, the first thing we've got to do is figure out how to inspire the clinicians and the people who support the clinicians to adopt the platform. Because if only a small group of people are using it, or it's only being used on one unit, or you've got, nurses using one form of communication and doctors using another, it makes it really hard to do those process improvement, micro improvements in the workflow. So you've got to have a platform first and foremost that's going to meet most of your needs most of the time. Is there one piece of software out there that does everything for everybody? Why? No, there's not. Right. So you have to, make a thoughtful decision about what your most important needs are and what kind of a platform is going to meet most of your needs. And so it needs to be rolled out at an enterprise fashion because you won't get that cohesion effect and the ability to have complicated workflows using the system and improving those complicated workflows if it's not enterprise-wide. So there's a thing called Metcalfe's Law, which says that the value of any CC&C program is exponentially related to the number of people who are using it, right? Think back to when you had a fax machine or you first got texting. If you only had 3 people you could text, it wasn't a very useful experience. But when everybody got on it, now suddenly it has a lot of value. So the first thing is that it's got to be enterprise, and it's got to give you flexibility to match the kind of communication to the situation at hand. Otherwise, you're going to have to put in another system to meet those other demands.
Yeah, when I look at this graphic here, Annabaker kind of reminds me of like the data to information to knowledge to wisdom pyramid that we utilize in the nursing informatics practice. So I'll just say that when you're looking at communication, collaboration, and care coordination, you have to ensure that you have those folks, right? The nurses at the bedside, the clinicians at the bedside, as well as the clinical informaticists working here in order to ensure that the staff has what they need. They have the competency, they have the understanding, and they have the ability to be able to utilize the tools that they're being given, right? So based on Mobile Heartbeat as a platform, and then what tools that you deliver or you serve up to the end user, I think is really important. And then you have to ensure that there's the governance that's required, which would be kind of that foundation that's being built as you're moving up that platform, up that stack of that platform.
Yeah, all those things are so important. And I think a thing we need to say overtly is that a clinical communication system is not a consumer communication tool. And the uses of text in a clinical arena are similar, but have some important differences, right? It's not about asking how are your kids doing today? And it's not about, sending lots of emojis. It's really about conveying information about the patient or the processes that we're working on together. And to create that shift from a consumer mindset to a clinical mindset is really important. And it really requires engagement from leadership to know that this is a clinically led operation. It's not technical, right? We all think we can hand out something that does texting and people are going to sort of know what to do with it. But that's really not the case because your intent is really to engage communication effectively in your clinical and operational processes. And as such, you need that operational and clinical leadership, which implies governance, because you may make a change about how you call codes or how you send alerts or when it's appropriate to use broadcast messages, all those things. And there's ongoing engagement with the people who are using it. And those are so all the change management that you used around adopting an EMR, or that you use around adopting a new set of IV pumps, or anything that really changes practice, all those change management approaches are very appropriate to use here. And when you engage the organization at that level, then you really drive adoption. And from there, you can then, start to think about the workflows that you want to improve, and you can start to integrate other devices like Nurse Call or your telemetry system, or output from your AI system, which we're going to talk about in a little bit, or interactions with your EMR. All those integrations then become really valuable because people are in that system. So there's all kinds of candidates from integration, and I would say that in the organization where we implemented this across 189 hospitals, what we understood was we were creating a platform for integration and communication, of which the CC&C was the first thing we did, but we did lots of other things on top of that, and it increased the power of that which was to be integrated. And we created a last mile to get the information from that integrated system out to the clinician. And we decreased the cognitive burden of the users because they knew where to look for a variety of information. But it was all based on adoption, and integrating telemetry was not the first thing we did, right? We made sure that everybody used it. They knew how to find each other. They felt good about it. They trusted it. Then we thought about using it to call codes. Then we thought about integrating telemetry. Then we put a bunch of other stuff on top of that even. So creating that clinical leadership, using your well-known change management techniques for adoption, and building trust in the system are all foundational.
Yeah, I agree. I think integrations are key because it really embeds it within the workflow for the end user. Right.
And now everybody sort of balks at, I don't want to spend that money on a phone. I'm just going to use this cheap little thing. But you miss out on the power of the platform if you don't have a device that's fully functional and capable of managing these integrations. So let's move into the here and now and the semi-future, Kathleen. Let's talk a little bit about how AI is getting integrated into clinical workflows. So what's going on with your team around this?
So there is a lot going on with AI. I always say, we need to be cautious with it, but exponentially, I believe it can be utilized to improve patient care. I think for the clinicians, there's a little bit of fear, uncertainty, and doubt. And I think education is really key to get them comfortable with, the utilization of AI in their practice, the ability to understand how to approach any implementation of artificial intelligence is key. So I'll just go through a couple of points. There's actually been written the 5 rights of AI in healthcare, and that was specifically written, as you would know, Annabaker, to reflect the 5 rights of medication administration so that nurses would actually feel comfortable with that terminology. But AI has to be applied in a systemic and standardized approach in order for it to be optimized, safe, effective, and also compassionate for our patients' care. So we want to make sure that we have the right objective for the correct problem and the population. We want to ensure the right approach, which is, for example, the workflow and the technology. Everything that we've talked about today could actually utilize artificial intelligence. We need our clinical users to have the right competency so that they're well trained and have the ability to effectively and utilize the information that they receive from the AI. We need the right data, so we have to be able to validate the accuracy of the data sets. We have to ensure that we mitigate any bias in the data. because we want to have the ability to operate reliable and trustworthy with the data for the information that we receive. And we need the right safeguards. So we have to have specific checks and balances around compliance and regulatory requirements. And those are all going to be very pivotal and key as we move forward into the future, because AI is so prevalent now. It's really the advent of generative AI has really democratized the ability for us to be able to utilize artificial intelligence in our clinical practice. So that is key. So we're going to see things around the agentic AI, which is kind of somewhat similar to chatbots, which can be more autonomous, as well as assistive, what we call co-pilot or assistive AI. So, an assistant to be able to help us as we move forward within our workflows. So I see a lot of positive within the AI as we're moving forward. We're getting closer to clinical. I think that we've been a little reticent to leverage especially generative AI in specific clinical workflows. We've been using AI and machine learning in clinical for years. We do predictive analytics and things like that. So AI has been around for quite a long time, but I think that the knowledge of it is kind of spiking as it's gotten more democratized. And I think we need to be thoughtful as we move forward as we're leveraging these AI models.
Yes, it's really important, again, as you pointed out, just to summarize, to really make sure that the clinicians understand how to be involved in the use and the delivery of the insights that come from AI, and that they feel like they can trust it. So all those steps that you talked about are really about developing confidence and trust. And developing all those insights, and especially timely ones, isn't going to do any good if you don't have any good way to get that information out to the clinician. And driving it through the EMR is not necessarily the timely thing to do, right? We're trying to get our clinicians out of the EMR, not into the EMR. We don't want them to stay in there to be looking for things that need to be acted on in a timely fashion. And we want it to be delivered right at the point where the clinician needs it. And so the EMR is not necessarily a good fit for that. So, and a phone call, not a good fit for that. And a dashboard, not a good fit for that. So you really want to make it easy to let the clinician know that there's some information here that you could use right now to improve the care of your patient. And a CC&C platform is a really good candidate for those kinds of timely insights. So, again, thinking about it from a micro process to a macro view, you want to have the right kinds of technologies to support the clinician doing the work that they need to do, but not so many that are duplicative or overlapping or cause cognitive confusion. And you, from an IT point of view, want to be able to have platform-like vendors who can answer a multiple amount of need and decrease the number of vendors you need to manage. And at the same time, you want to be able to distribute your risk a little bit. You don't want to put everything in the same bucket, because if you have a CrowdStrike event or other kind of cyber event, or then anything that depends on the technologies involved are going to be affected. So you need to have enough variety so that you mitigate your risk, and enough consolidation that your management is efficient. So that's a thoughtful decision that every organization needs to work through. So from a overarching summary point of view, integrated platforms are really important for all the reasons that I just talked about. Being able to improve the workflows and have a basis for optimizing workflows as time goes by. The workflows are going to change over time, and process improvement is an ongoing event. And you need a communication platform that's going to allow you to think about the communication components of those workflows and make them as efficient as possible. You want to be able to send actions to the clinician in a way that's helpful and not fatiguing or overwhelming. And that's either going to be based on alerts or alarms from integrated systems, or generated through probing through your large amount of data and sending it from a generative AI point of view. And really, all of this is in service of having better outcomes for our patients, right? That's the whole reason we're doing this. It's not just because it's fun, because I like working with all that technology, but we weren't doing it for my entertainment. We're really doing it to improve the outcomes of the patient. Kathleen, do you have some final thoughts for us?
I would say for me, it's 100% Annabaker agree. It's making it, better clinical outcomes for our patients. And then, kind of removing the friction and bringing joy back to our providers' bedside care, because I receive great joy in doing patient care. And I know that it's really gotten to be very filled with a lot of strife out there at the bedside. So I'd like to make it better for them. And actually, I have been a patient in the near term, so I know how my providers felt, and I would love to have made it better for them.
Yeah, I think that's a really important point. We need to take care of our clinicians and making their life easier, making it streamlined, making it predictable, and giving them some sense of autonomy over how they use the technologies. I think is all really important.
Agree.
So I want to thank HIMSS for hosting us today, and I think with that we can probably move on to questions.
Well, thank you to our speakers for a wonderful presentation. And I want to remind our audience that you can continue to submit questions in the Q&A window to the right of your media player. And here's our first question. What are some examples of clinical communications platforms addressing immediate operational challenges, such as reducing clinician burnout and optimizing resource allocation?
I'll take this one first, Annabaker, if that's okay. I'm going to say that a platform like Mobile Heartbeat really streamlines the communication workflow and enables faster response times and better coordination among the team. I'll also have to throw out, that we do have Dragon Ambient experience at Microsoft, so Copilot that really uses AI to help with patient encounters. So we're really looking for how we can improve those operational changes, reduce the clinician burnout as far as cognitive overload. So being able to optimize resource allocation and providing real-time insights into patients' needs and what their requirements are, I think is really important.
Burnout is so multifactorial, right? It's feeling overwhelmed by the amount of things that you have to do and the resources that you have to do it. It's related to the culture of your organization and how well you feel appreciated, and it's being able to operate effectively from a mental and emotional point of view. So a clinical platform can go a long way. I mean, our communication platform can go a long way in decreasing that cognitive burden for all those reasons that we just spent the last hour talking about. And, that's subtle and very important in the clinician's frame of mind and their sense of being able to do their job well. The second thing is when you have a unified communication platform, you have a piece of cultural glue. And that piece of cultural glue improves people's sense of belonging and feeling valued and feeling like they're part of the organization. So if the doctors are on one system and the nurses are on another and the bed managers are on another, then you're creating silos that are adding to that sense of isolation, which adds to the sense of burnout. And when people are feeling overwhelmed by having to go search through an EMR to find information or remember 5 different ways of doing something or remembering phone numbers, all of that adds to the cognitive burden, which makes it harder for people to have the energy to deliver good patient care. So it's subtle and powerful, and I think sometimes gets overlooked in the value that it brings in terms of ease of use, ease of communication, ease of doing your work, and feeling like you're part of a cohesive whole.
Excellent. Here's another question. Can you please speak to how clinical communications platforms provide sustained value over time, particularly as healthcare organizations evolve with value-based care models?
I think healthcare organizations are looking at all kinds of levels of delivering care. So they're changing care models within the hospital. So virtualized care is coming to hospitals near you inside the four walls. We're looking at various levels of care outside the hospital and in the home. So whether that's hospital at home or monitoring the patient on with a wireless device and sending that information to clinicians who can take advantage of it. You've got ambulatory levels of care, and you really need to be able to communicate across and among all those levels of care. So CC&Cs need to evolve to be able to consume and information from those levels of care and to be able to distribute the communication out to there. We need to also think about how the patient plays a role in that. And again, we want it to be real time in many cases. So the platforms need to be able to provide that kind of real time, being able to find the right person and connect up the workflow processes that depend on communication that way.
Yeah, and I'll add that I think that sustaining value really happens by improving operational efficiency, and then that will also help with care quality. This transition to value-based care, a clinical communication platform really facilitates, I think, better coordination, better collaboration among the care team members, which ultimately lead to improved patient outcomes and reducing cost. And those are key, those are pivotal for value-based care models. So being able to support that timely decision-making, the seamless integration, and having that unified communication strategy, I think is key. And that's why a clinical communication platform like a mobile heartbeat is really effective, and that really will improve overall care delivery.
Well, we have time for one more question. Where does communications fit with health systems that want to be cutting edge, and how does AI fit into this strategy?
And I'll take that one, Annabaker, first, and maybe you can kind of pile on. So clinical communication is actually integral to health systems, really, if you want to be at the forefront of innovation. Effective communication platforms really streamline the exchange of information between our healthcare professionals. I think, as Annabaker spoke very eloquently to, being able to enhance collaboration and decision-making, we can actually leverage AI to play a role in that, right? It can actually be a strategy that can kind of augment our clinical workflows, helping us improve those patient outcomes. AI, I mentioned a couple of things, being able to automate tasks, reducing administrative burden, having the ability to kind of have that assistant. That really allows the clinician to focus more on patient care. The other thing is, we didn't really mention so much today, but we know there's a tremendous amount of data, and it's really difficult for the providers to consume the volume of data that we actually have on our patients today.
So I think that, good communication platform is fundamental to any kind of innovation that you want to do. If you don't know who's taking care of the patient, if you don't know who's in certain kind of roles, then it's very hard to send insights or information from any kind of integrated system. And if you think about AI as a really fancy form of an integrated system, that information's got to go somewhere. That insight's got to go somewhere, and it's got to go in a timely fashion. So without a good platform and a good directory and lots of different ways to find the person who needs to receive it, then it's going to be very hard to take advantage of the insights that AI is going to give you. And if you expect the user to go find it, then you can be pretty sure it's going to go underutilized. Nobody's going to go look at a dashboard. Nobody's going to, we don't want people going to the EMR to find a timely thing. We'd really like to bring that timely thing to the clinician.
Excellent. Well, at this time, we do have to wrap up. Thanks again to our speakers for all of their insights. And once again, we want to thank our sponsor, Mobile Heartbeat, for their support of this webinar. For our audience, don't forget to take our brief evaluation at the end of today's event and share your thoughts with us. As a reminder, you'll receive an email within 24 hours to re-watch the on-demand recording of today's event, and it'll be available in the HIMSS Resource Hub for a limited time, so feel free to come back and watch anytime. Thanks, everyone, and have a terrific rest of your day.